Hello there.
Hey.
My name is Kemi Oyeshola, and we have Caroline here. She will introduce herself. And we are from the BABN network, British African Business Network. It's located in the United Kingdom, but we're from every part of the world. So you're welcome to a bite-sized, quick-fire interview with one of the members of the BABN network. And so we really hope you would enjoy this. It's 10 minutes, so we're expecting you to pay attention when you play this and glean from the wisdom of some of these or all of our members who run their own businesses. As I said, I'm Kemi Ishola, I'm one of the members. Right. So I'm going to ask Caroline, our first question. Tell us a 1 minute story of how you built your business. Tell us your full name, name of your business, and how you built your business.
Okay. So my name is Caroline Okoro, and I've been thinking about this business for a while now. I'm a qualified pharmacist. I got my pharmacy degree from the University of Ife in Nigeria, actually.
Mm,
More than 25 years ago.
wow.
Though I was born in the UK, I spent a lot of time in Nigeria doing my education. And then when I came back to the UK, I joined the system, the overseas conversion course to become a pharmacist in the UK.
Mhm.
And then you do some internship training as well. So I got all of that done and then started working in the community setting. So community pharmacy in the UK. I worked with a lot of the big companies like Boots, Superdrug,
Okay.
Rowland's Pharmacy, and I did a lot of locoming as well. And then
Okay.
I spent, I would say, about 15 years doing that, and after a while, I rose to the height of my career as a community pharmacist. I became a superintendent pharmacist. And when
Ah,
I rose to that level, it was like, what next? And then the UK government started introducing this system in place where they had allied healthcare professionals to help. Because what's been happening it's not only in Nigeria that you have brain drain as well, you also have it here. So sometimes we have an aging population that is living longer. So we don't have enough healthcare professionals to sort out the problems of this aging population. So it's becoming overwhelming for the doctors. So a system was put in place whereby nurses, physiotherapists, pharmacists are given extra training where they can become prescribers themselves and also assist the
okay.
doctors. So when
Ah,
this system came up, I took the opportunity to become a prescribing pharmacist. So when I became a prescribing pharmacist in 2017, I now realized that, okay, that there was a gap in my knowledge because I've come from a position where I'm working in community pharmacies, a different kind of skill set. And
mm,
there was gaps when it comes to how to carry out consultations, clinical skills, clinical examinations. So I decided to go and do another program, a master's program, where I became an advanced clinical practitioner.
mm,
That one, you now gain more clinical skills. And when I did that, I was now able to work in doctor's surgery, GP practice.
okay.
So we were one of the first batches of advanced clinical practitioners in
Oh,
my community, which is Uppington. So
okay.
again, there was a lot of challenges when I got to the doctor's surgery. What do we do with you? What's your skill set? What can you add to the table? So when I now realize what you can do, oh dear, you become overworked. So
Mm,
you're handling all the medication queries, you're dealing with all the anything that has to do with side effects, advising customers, and then you're also running minor ailment clinics, hypertension clinic, diabetic clinics.
wow, wow,
It was just so much. One
wow.
thing I found in GP land was it's like you have to do so much within a short period of time. I
Mm,
felt like I wasn't giving my best to the patients. I started thinking, okay, what next? What do I do? That's where the dream of opening a private pharmacy arose, where I could be in control of what I'm doing and give patients my time and be able to offer the best care possible without somebody knocking on my door and telling me, oh, 15 minutes is up, next patient, next patient, next patient. So
mm.
that's the background of what led to me doing this.
Oh,
I don't know if
wow.
that's answered your question in a
Oh,
short.
wow. I have gone on history land. I've gone a bit deeper into how things work behind the scenes in
Yeah.
the medical, pharmaceutical, amazing. Oh, wow. You've been everywhere.
Yeah, I
Your
know.
business must be amazing. And
Yeah.
so you own a pharmacy.
Yes, I own
That
a
correct?
private pharmacy now in the UK.
Okay.
So it's a non-NHS pharmacy because again,
Okay.
they do give out a few NHS contracts, but the hours are like it's going to be very long and ungodly. I didn't feel like that would suit me. For you to get an NHS pharmacy contract now, you need to commit to being able to open late hours, long hours,
Wow.
because we don't have a lot of pharmacies that open. That's where there's a gap. That's where there's a
Night.
need that
Yes.
open like 11 in the night from 9
Yes.
in the morning to and that's family life that just wouldn't work. So that's
Yes.
why I went down the private pharmacy route.
Okay. Can we see a bit more of you? We're just seeing your head.
Yeah, how do you make I'm trying to
If you move your laptop backwards, if it's, yeah, correct. Oh, this is so much
okay, that's
prettier.
good.
Thank you. Thank you for that. But
Thank
we need to
you.
fill that gap.
Okay.
We
Yeah.
need to fill that gap. We know it will affect family life, but people fall ill. So, for
Yeah.
those of you listening, if you're into pharmacy, you might want to fill that gap. We need to fill that gap.
So
And if
that
you think you will find a way where it may not affect family life as is right now, that's what we think. But if you sit down and really reason through this, you will get an answer. You were going to say, ma'am.
Yeah, so it's the cheapest way to get a pharmacy now is if you start getting your contract yourself from the beginning. It might seem hard at first because
Mm,
what people are doing is buying existing contracts already, existing
mm,
pharmacies which have normal opening hours. But if you're
mm,
already, like as you said, push yourself a little bit more, go outside the usual boundaries, you can apply for, the out of hours kind of contract for an
mm,
NHS pharmacy, and
mm,
then you wouldn't be buying it at ridiculous prices because people who've already established pharmacies, you're buying the goodwill. It can cost up to 1 million, more than 1 million,
mm.
lots of thousands,
Wow.
hundreds of thousands. But if you're
Pounds.
starting from the scratch, you get your contract yourself and
One
you build it
million
up.
pounds, not
Yes.
naira. Yeah, pounds.
Yes.
Yeah,
You can get some for 500,000, don't get me wrong, but it's
pounds.
priced based on the number of items and business activity that you're doing
Oh, right,
and goodwill.
right.
So the number of
Okay,
NHS items you do is how they
okay,
price them. Yeah.
okay. And what are they pricing?
So the
The
that's
drugs?
the NH no the NHS contract, the
Oh,
items that
right,
you're
right,
doing.
right, right.
Yeah.
Okay,
And then
okay.
all the other services that you offer, that's what
As well, as
yeah,
well.
that's what
Okay.
helps them
I
make
was
up the
about to
price.
say, what other services aside from selling the medicines do you offer?
Is it me as a private
Yes,
pharmacist?
as a private
Okay, so
pharmacist.
me as a private pharmacist, we do travel clinic. So let's say you want to go on holiday,
Ah, okay.
so you want to go to Nigeria, for example. We always take things for granted. The diseases like yellow fever, meningitis,
Mm,
hepatitis B, you need to get your vaccinations done, cholera, typhoid, hepatitis
mm,
A. When you go to a website called Fit to Travel, it tells you, you put Fit to Travel Nigeria, it will tell you all the requirements of what you need regarding travel. So we take care of that. Anti-malarials in our travel clinic.
mm.
We also have a phlebotomy service. So let's
Okay.
say in the UK, your mom's visiting you, for example, Kemi, and she doesn't have access to the NHS. You can come to us and we'll do a full blood test,
Mm,
and then like a health MOT, for example. We do
mm,
ECGs as well, where we can have
mm,
a look at the heart, see how it's
mm,
working.
mm,
Is it overworking? Is it beating right? And any
mm,
problems that will show up in an ECG.
mm,
And then we
mm.
do a complete full blood test as well. Are the
Okay.
kidneys working properly? Is your liver working properly? Any problems in the body will be picked up usually from a blood test. So we do that
Mm,
here. We also do minor ailment consultation. So let's say you have a coughing for weeks, and you
mm,
want to know whether it's a chest infection or a virus infection. Do I need antibiotics? We can handle that here.
mm.
So things like that, minor ailments. We also
Okay.
do sexual health,
Okay.
screening.
Okay.
Yeah, in a nutshell.
Stuff like that. So are
Yes.
you listening? Approach her. We are going to put in the how to make connect with Caroline and know exactly where to go, phone number and all that underneath this video so that you can reach out to her. All right, thank you for that. That was quite comprehensive. Thank you. So, question number two, what one thing can you say has been responsible for your business success so far? One word or one phrase?
Determination.
Oof. That's one of the fundamentals of how to think to win. You must be determined. Stay with it till you get to where you are going. Love that answer. Love that answer. Our third question is, in business or life, what weakness do you still have that you believe limits you, and how will you overcome it?
um, there's a quality that I have. It can be
Both
a
are good
positive or a
and
negative.
yeah.
So I keep working hard at it. I'm not the most diplomatic of people. So
Welcome, my king.
I see it,
Welcome. Nice
I
to meet
say it as
you.
it is.
Yep.
And you sometimes need to learn how to coat it. I do not
Yes,
do that very
yes.
well. So
Okay.
I'm trying to learn to be economical with my
With your
words
words.
when I
Okay.
need to be. So
Okay.
that's a quality. And sometimes people like the honesty. So it's getting the balance right. So
Okay.
that's
So
where
that's,
I
you call it
where
both a strength and a
a
weakness.
weakness.
I
So
see it fully as a strength because that's how I am. But I don't think you should sugarcoat anything. I think you should still tell the truth, but it is what is, okay, we call it sugarcoating. It's it's the heart from which it's spoken. Because
yeah.
I'm sure you're not saying it to be wicked and to be nasty and to be,
No, because
no, you're
sometimes you get
just,
you're rude.
yeah, but that's fine.
Rude.
That's that. Yeah. In my business, I hear it and I invite them to go and hire another coach. It's not a problem. But
Yeah.
I'm not changing my standards or my values. If that's wrong, that's wrong. And let's think about it a bit further. We are not serving them and we are not being kind if we don't tell, if we see something wrong and we don't say it just because
Yeah.
they will feel one way. We cannot
Mm.
live by our emotion. That will come and go. And I'm sure as you do, we want people to come into our space and leave us having been served, having been helped, being better. Not just the way they've always been because they want to suck their thumb and pick their navel. Nasty. Thank you so much for that. And our final question is, what one thing can you share with us that will surprise the listeners about you?
Mm.
What's one thing?
Ah, that's a good one. What will surprise the listeners? My age?
Oh, she's about to tell. Let me make the ground soft. I'll be 61 in July this year, and I'm
Okay.
always told I don't look my age, so tell us.
Okay. Okay. I'm 54 myself.
What?
I'm
I
gonna 50,
thought she was
yeah.
34.
No, I can't be. I still have been practicing for 20 something
Yeah,
years.
don't worry about all that. Honestly, I put you in that zone. I said she can't be a year over 40, but maybe somewhere between 34 and 40. So
No, so I thought that would surprise you.
it is, and you've got a
There you go.
gorgeous smile to go with it. So, gentlemen, she is. So I was about to say she's 34. She's
No.
54. That is shocking. You don't look it
Oh,
one
thank
day. I
you.
think we're all getting younger as it goes.
Yeah. Oh,
So,
I forgot to add lifestyle advice we give here as well, and
okay,
weight
okay,
loss, how to keep
okay.
healthy, those kind
Yes.
of things. They help.
That's
So
important.
yeah, I
It
forgot
does.
to add
It
that as
does.
well.
It really does. I work out and I watch what I eat and I think right. You can watch what you eat and work out and still get cancer. And I believe cancer comes from within, it's not from without, because
It's
you're
making
not
sure
what you.
it's the free radicals. So, and it's stress
Yes.
really.
Yes.
When you're
And
too
stress comes to,
stressed,
yeah,
yeah,
you are thinking that
yeah,
exactly.
yeah.
So we can really sort ourselves out and stop giving doctors and pharmacists so much work. If we just do what they say. Thank you so much, Caroline. This
Thank
is
you for
most
having me.
appreciated. I'm so glad we started with you. Your smile lights up the screen.
Oh,
Mine doesn't light it up as well. So you have compensated for my smile. Thank you so much. God bless you. I hope you are served by this video. I know we went over our 10 minutes, but you have to agree with me that it was worth it. Put your questions in the comments below. Tell us what you think about it. We will appreciate it because we're looking to make things better and stronger in BABN. Stay strong and bye bye.